So let me take a moment or two just to introduce everyone so we all know who everybody is. We'll start with Andre Picard. I've interviewed Andre just a couple of weeks ago on Breakfast Television about his new book. Andre Picard is the health columnist at the Globe and Mail and the author of 5 books, including the current bestseller, Matters of Life and Death. We've had some very interesting conversations about the public health system, so I'm very much looking forward to you. Anna Marie Fuchs, a healthcare consultant and patient advocate. She's been involved in healthcare for more than 30 years. She offers a unique perspective as a passionate advocate, applying years of experience in clinical nursing practice with her work as a consultant involved in project management, governance, and policy development. Then we have Scott Macleod on the end there. Hi, Scott. Scott Macleod is the registrar of the College of Physicians and Surgeons of Alberta. He's the licensing and regulatory body for Alberta doctors. He received his MD from the University of Saskatchewan. That's my alma mater, too. Good times. In 1993, and he has a Master of Public Health from the University of Texas and a Master of Public Administration from the Royal Military College of Canada. Scott's particular interest is the delivery of safe, high-quality healthcare by qualified and healthy physicians. Of course, we have Dave Price, Greg's dad. Thank you so much for being here, being so courageous. Dave Price was born and raised as a part of a mixed farming family in the area near Acme, Alberta. He's one of the founders of what has now grown into the Centera group of companies. Dave and his family are working to encourage everyone to a more prepared partnering in care to support improvements at all levels in the healthcare system. And then we have the new guard. This is Sarah. Sarah Smith. She is a medical student. This is very exciting. So Sarah Smith is in her last year of medical school at the University of Calgary. She is a VP of Education for the class of 2019. She is actively involved in efforts to improve medical education at the U of C and across the country. She is passionate about improving processes and policies that improve access to healthcare and information for all Albertans. Welcome to you all. Thank you so much for being here tonight. I think we should just start with first reactions. If we can just go down the line, and if you can keep this first reaction to about that minute mark, that would be ideal, and then we can dive in a little bit further. Andre, let's start with you. What is your first reaction to seeing this film?
Well, I see a lot of medical educational films, and none of them are of this quality. So it's a really good drama. And then to me, it shifted from being a drama to being a horror story when I saw The Fax Machine.
I had the same reaction to The Fax Machine. I went, oh no, terrifying. Anna Marie.
So a couple of immediate reactions, I think. I've seen the film twice now. In the late fall, I saw a screening at the university. And I saw it from the point of view of a health professional. I was sad and frustrated all at the same time, because as a health professional, we all see the places where the system dropped and there were gaps. Tonight, I'm seeing it from the point of view of a patient advocate and a mom. Our son, Mike, is exactly the same age as Greg. And you know, we watch Mike interact with his family all the time, and I can't even comprehend the loss that Dave and his family have experienced. So, like I say, a mixture of feelings, frustration, anger, and deep, deep sadness for what we're seeing tonight.
Absolutely. Sarah.
This is also my second time seeing the film. We talked about Greg in our first year of medical school, and I got to see the film about a week and a half before I started working in the hospitals as a medical student, and then again tonight. And the first time I saw the film, I had the kind of same reaction as I do tonight. It's just, it's heartbreaking, and it was very real as a student about to enter into the system, as someone who's working for the system, kind of going in eyes wide open to see what can go wrong. And it's just such an important thing for us to be learning as students.
Absolutely. Dave, what are your thoughts seeing this movie again tonight?
Well, really, I'm here to actually learn from the audience and from the panel. We are obviously proud of the film and the product and the people that did the great work to produce it. And it's obviously a number of times that I've seen it now, so every time is a little bit different, but looking forward to what the audience and the panel have to say.
Terrific. Scott, what are your thoughts?
So this is also the second time I've seen the film. I was fortunate that Dave and Terry shared that with me a few months ago. And at the time, all I could say was, wow. Mainly because I was so impressed with the Price family to be able to put something like this together after such a tragic event. And then the other thing that struck me was what an opportunity we have to try to make a difference now in our healthcare system and learn from this. this awful experience, but not dwell on it, but grow from it and actually turn our system into something better as a result of it.
Absolutely. Isn't that really the nugget? That it is an opportunity to learn and to move forward and to try to make sure these things don't happen again. Thank you for that, Scott. Bill, did you want to take something from the audience right away, or should we go into question 2?
Well, I think we can, make sure this is on. So I just want to pick up Scott's last point, and there is a question, and this was submitted by somebody named Shannon. If Shannon wants to wave and take credit, she can. But it's on your last point, and I think to the extent that Greg passed away a number of years ago already, the question is, how has this story inspired and created changes in the Alberta health system? We know that there was a report produced by the Health Quality Council. Dr. Ward Flemons was involved in doing that. I think a number of things have changed in the system, even in the relatively short time that's passed. Maybe, Scott, I could direct this to you to start that answer, and anyone else can chime in.
Sure, I'll certainly try. The one thing that wasn't pointed out is I'm brand new to Alberta. I've lived here for a grand total of about 11 months now. But what I can say is, being an outsider coming into this healthcare system and meeting so many people that have really committed themselves to make a difference and change and try to make the healthcare system better, I have been very impressed with that. Yes, we've made changes to our standards of practice for the College of Physicians and Surgeons and set expectations for physicians and so forth. There's investment in the electronic health record systems, trying to make sure that our sharing of information and sharing of data leads to improved healthcare, leads to improved communications and all of that. But more so, I think there is a desire to make a difference. People recognize that there's a lot that we can do in our healthcare system, and it's stories like this that we share that remind us that there are people that are involved in all of this, and it's our responsibility to make sure the system works in the best way for the people that are coming into that healthcare system.
Thank you, Scott. Andre, can I come to you now just for, I'd love to go down the panel, and because each of you brings such a unique perspective to the film and the discussion, if you can start thinking about sort of, one thing that really struck you that we might be able to focus on in terms of change from your own perspective. So Andre, I know you and I've talked a lot about the public system and how it's sort of set up to benefit the practitioners sort of more so and not really the patients. What are your thoughts on that in relation to this film?
Yeah, so I think what anyone who watches this film, I'm sure everyone in this audience saw themselves in some scene or several scenes of the movie. So we've all had the appointment forgotten, don't get the call back, phone the doctor, and there's just a message called back to Tuesdays from now between 6 and 6:02 a.m. All these absurd rules that exist that are not patient friendly. So that, I think that the film is essentially a microcosm of what's wrong with the system. So yes, it's gotten better, but it's not gotten better fast enough. So every problem that we have and every problem that Greg had, he didn't have any medical problems, right? He got good medical care when he was at the right place and the right time. What he was a victim of, it said at the end of the film he was not killed by the system. I would disagree. I would say he was killed by a lack of a system. So every problem we have is a structural problem, an administrative problem, and that was shown over and over again in a very eloquent fashion. That's what we have to fix. We have great medicine in Canada, we have fabulous health providers, but we make it really difficult for them to deliver good care because of our clunky system. It's not connected. It's a bunch of silos that really don't talk to each other, and again, that's what kills people.
Anna Marie, what are your thoughts on this? You're big in terms of being a patient advocate and teaching people how to advocate for themselves. What are your thoughts on that when it comes to this film?
Boy, I have so many. You're right. Drucker talks about the healthcare system being the most complex system in the world, and we in the system know that, and yet the system is designed to operate pretty much the way it does. There's a guy named Darren Larson that writes a blog, and he talked about trust and accountability in the system like a three-legged stool. And he said, we need accountability to our patients, to our peers, and to the system. And so when I think about accountability to our patients, that, when Greg's information was dropped, someone there needed to pick it up. We needed to feel accountable for other than just our own job description. We needed to be accountable to the patient. When we think about accountability to our peers, this isn't a race, but it is a relay race. And so when a baton gets handed, if we're really accountable to our peers in the system, we need to pick up that baton before it does drop and help each other out, because it is the most complex system in the world. Wired magazine a couple of years ago said that in the last 2 years, 90% of all the world's data has been accumulated only in the last 2 years. We're living inside a network. That network is not going to go away. We have to pick up the baton for each other if we want the system to change for the next person that comes along. And then accountability to the system, exactly like I just talked about. If those three pieces are in place, we'll have a better system. So that's one thing that comes to mind. When I think about my role as a patient advocate, and I work with Imagine Citizens and other groups and with individual patients, I think about what happened with Greg and what could we have done differently. And what I tell people now is take a set of 2 or 3 good questions that you need to have asked and answered to your physician. When you have lab results done, ask for copies. My physician gives me copies every time now because she knows I'm going to ask anyway, so she just gives it to me. Collect a copy because the system isn't quite ready to have interoperability across all of the electronic systems that exist. So ask the right questions, collect copies of that information and hang on to it. And then if you have a consult or if you have to have a procedure done, there is nothing in this world more important than your own health. Nothing, if you have a ticket to the Galapagos, okay, that might be a little bit hard to change. But otherwise, and nothing else is more important. We have a family member who has had lots of issues in the last year. And he phoned to arrange an appointment, just like you saw in the film. And it was going to be 3 or 4 months down the road, and he's quite sick. And he said, you know what, my health is the most important thing in the world to me. I'll drop everything. Just put me on the cancellation list. And they said, we have a cancellation this afternoon at 2 o'clock. Do you think you can be here? He was there at 2 o'clock. So I tell people, make your health your most important priority and drop everything if you can get into the system. Because until the system is functioning more smoothly, patients need to know that they have permission to get onto waiting lists or cancellation lists or call into work and say, I can't come in, I've got an appointment. It's your priority.
It has to be a priority, no question. Thank you for that. Sarah, what are your thoughts on this? I mean, you're just about to enter into this field. You're a student. You're heading into the system. What are your thoughts on it in relation to the film?
One of the things I think of when I watch the film and I think about the story and being a medical student in Canada now, I think about access to information from the patient side and also from the physician side and the healthcare side. When you talked about asking your physician for your labs, I asked my physician for my labs once, and she said she was going to charge me $20 to print a 3-page document of my own personal lab results. Right? That doesn't make any sense. My parents live in British Columbia, and they can look up their lab results online, and they can read their X-ray reports online. Now, having said that, I've, as part of a medical student, I get to go all across the country. I've been in Nova Scotia as a medical student, seeing how their system works. I've been in British Columbia, in Ontario. I'm going to the Northwest Territories, and every province is different. And if you go into a hospital in Toronto, they have no idea who you are if you're coming from Calgary. And I think that just doesn't make sense. Like, physicians and all allied health professionals need access to everyone's information. We have so many different kinds of electronic systems that everyone's using a different one. They don't all link up. And I think that's just such a simple fix, a very complicated, hard thing to do. But if we all got on the same page, information would be much more easily accessible to everyone.
Absolutely. Wouldn't that be wonderful? That would be wonderful. Dave, do you mind if I skip over to Scott just to get the patient or the physician perspective, and then we'll come back to you? Okay. So Scott, what are your thoughts on this? What can doctors do? How can they help?
Well, I think there's a couple of angles to this. First of all, physicians are obviously an essential part of the healthcare system, but they're not alone in the healthcare system. This is obviously a team approach, and physicians need to embrace the concept of this being a team, and an essential part of that team is the patient, obviously. And unfortunately, in a healthcare system, that does get forgotten quite often. It shouldn't. And we also seem to be very cautious about the protection of the information. There's this desire to protect everything and that we shouldn't be sharing it for some reason. But I'm curious, and I'll ask the audience here. As Sarah pointed out, if you go to Toronto, they're not going to know who you are. The reality is if you're from Calgary and and you go to Edmonton, we're not going to know who you are for a lot of it as well. So who here would care if that information about your health was accessible to other healthcare providers, even just within the province? You know, for those who wouldn't mind, I'd like to see a show of hands, just to get an. Okay, so, you know, my impression is that people want this, but the system has a belief that we need to protect that information and not be sharing the information as readily as we should be. And what we do need to partner with patients more and have patients as a part of the team and really embrace that. So you do have access to that information, and that information should be easily shared with other healthcare providers in the team so that we can provide better healthcare overall.
Absolutely, Scott. Thank you. Dave, was this ringing true for you when you're hearing some of these ideas and suggestions? Does it give you hope?
Well, for sure. I think we've seen a considerable shift in attitude, I think, over the last 5 years or so. And I think the part that's happening is people inside the system and the new people coming to the system have a more open mind and are connecting better with the patients. I think on the public side, and that's part of why we are so interested in this film being used for that other use that we didn't envision to start with, and that is having the public itself become first informed about what can happen, be prepared to deal with the advocacy and the engagement that you need to do, be a true partner, and a partner means a decision maker, not a participant, in how the care is appropriately decided to be doing. And then to be in a position, having learned those things and understanding that, be in a position to be able to support the great work by the people that are trying to move the system forward and make it more improved, so that together we can make that happen. And that's the team concept extends for me beyond the players inside the system to the public. And then that team together can sort of move the needle on the direction that we need it to go and reinforce the kind of comments that have been made.
That's wonderful, Dave. Bill, let's go to you. What are you hearing? What have you got there for us?
Okay, so I'm combining a few questions here that have come. So a few people have asked questions along the lines of, is this an isolated story? Are there more Gregs out there? So I'll answer that question just factually. We know there's a Canadian study, the Canadian Adverse Events Study, that estimates that there are as many as 20,000 preventable deaths in Canadian hospitals each year, which is a pretty staggering number, a study done in 2004. Not unique to Canada. We know that there's an adverse events study done in the UK, a similar one, Australia, and the United States. Very similar numbers when adjusted to population. So healthcare has hazard, no question. So then extending, so that answers, several of you had that question of is this isolated? So it's not isolated. Then a very well phrased question without an author, without a stated author. Is this a made in Alberta challenge? Do we need to engage stakeholders beyond our borders? And so I'd like actually to hear from Dave, because I know there's a family strategy and Greg's Wings strategy around the film, and perhaps Andre, whose role is really promoting discourse nationally around health issues. So perhaps start there.
Perfect. Dave, let's start with you.
Well, I think we recognized fairly early on that while Alberta has some unique character, the challenges that Greg faced and some of the breaks in care or the gaps there are not unique. Ward and I have traveled to conferences speaking to audiences primarily associated with the systems in each of the provinces. And at those events, we also hear others that are speaking of a similar experience or similar challenges. And so it's not hard for us to sort of make that next jump to thinking about, well, if this film and the quality that the team put together on it is useful here, it has potential to be useful elsewhere. And so our strategy really is to respond positively to anybody that wants to be able to use the film in the right vein and to support improvement. And that extends across the country. Ward and the team at the coming school are developing curriculum that can be used in not just Calgary, but other institutions that are interested in it, and we're very happy about that as a family. And then, of course, where there are conferences or even communities that are interested in taking advantage of the opportunity to raise awareness and potentially start people thinking and moving in the right direction or reinforcing movement that's already there, then we'd be happy to respond to that. And Ward and the team have applied for it to be used in some international instances, which we're going to be responding to, and we're actually taking it across the country. Terry's been working hard at organizing spots that we can go with some national organizations. We'll be in Ottawa, St. John's, and Vancouver in the month of June, and Ward will also be presenting to the University of Toronto and hopefully get extension from there. So I think that we're happiest when more people see it, and our strategy as a family is to start with it this way. And when I made my initial remarks about learning from you, the audience, that's the first phase, is understanding how audiences react to the film. Because one of the things that we're most concerned about is making sure that when you leave the room tonight, you leave the room not full of sorrow and trepidation, but rather with some sense of hope and engagement. And we're putting together, Terry's putting together along with the Chaotix team here in Calgary, an online platform that we're calling Co-Pilots Collective, that any and every one of you can become a part of, be part of the conversation, bring your experiences, your expertise, your ideas, so that we can actually generate not only knowing what the challenges are, but what the solutions might be, and then work with the people that can make those things happen and do it in a way that actually moves things forward. So that's our kind of strategy.
Thank you for that, Dave. Andre, what are your thoughts on this? I guess politics comes into play too, doesn't it?
Yeah, well, healthcare is very political by its very nature. But I think, to me, the themes in the film, again, are universal. This is not unique to Alberta by any stretch. You know, the themes of the patient being bounced around like a ping pong ball, the breaks in service, the lack of accountability, the waits. You know, Canada's known, I travel around the world. What's Canada known for? That's the place where you wait for everything, right? And Canadians are too accepting of that. So there's some cultural stuff there that's universal. I'd say, if anything, Alberta is a little better placed than many provinces. You have much better electronic health records than probably all the other provinces. A little more organization because of the regionalization, although I know you like to change the number of regions weekly. That's a particular quirk to this province. But you know, if anything, these stories happen in other jurisdictions, and they're worse. And they're worse because the great strength here is you're talking about it. I first heard Greg's story in late 2012 at a conference. This was already being talked about, and that's, I think, a feature of the Alberta system, this willingness to hear, to address mistakes and talk about them publicly and act on them. That's what's made the system better here, faster than other jurisdictions. So I think a lot of credit has to go to the health providers for being willing to hear this, and for families to come forward. I get to talk to many, many families in my work, and I know it's not easy. You sit there and it breaks your heart every single night, and to put themselves out like that for the benefit of others is really touching.
It really is, absolutely. Anna Marie, can I just ask you to weigh in on this? I mean, when you're sort of seeing this film and you're hearing these conversations, you know, and you're trying to educate patients about how to advocate for themselves and try to change the system a little bit, do you personally see a change happening even from the patient side?
I think, yeah, I see a change happening from both sides. I see an increase in awareness on the part of patients that we and they do need to advocate for themselves more aggressively. We need to be more aware of our own issues as patients and as users of the healthcare system, and we have to be willing to ask the hard questions. And like I said earlier, collect the information that you can collect and keep track, and make your health your priority. So I think that's beginning to change. I'm seeing a momentum across the system as well, though, and it's a positive momentum, and Scott and I were just talking about this earlier. I think I was telling you about it as well. We're just embarking on a large partnership to develop a project plan around professionalism. And by professionalism, I mean all of the elements that make us better at what we do in serving our patients. And in the last 4 months, I've interviewed 70 people now, and I've had a total of about 100 interviews because I've re-interviewed several people. And there is a lineup of people, and I mean health professionals in the system, that want to talk about professionalism. They want to talk about wellness. They want to talk about the chaos in the system, about the things that they've seen that they want to change. And, you know, 30 years ago, there was an element of protectionism and elitism and secrecy in the health system. We did the best we could with the situations that were in front of us, and there wasn't a lot of conversation outside of that world, where now it just seems to be there's a momentum and an energy building that we can work together to improve the system. I know we have a long way to go. Terry and I work together on some stuff where we're trying to launch what's called Citizens for Digital Health, and we've been supporting Imagine Citizens with that, focusing on some of the digital health initiatives that need to improve in Alberta and across the country. Patients are the owners of their health information. And if Greg needed to be his own advocate, and I need to be my own advocate, but all of the health professionals have more access to the information than I do, then Greg was kneecapped right from the beginning. He was handicapped. You know, you can go to a debit machine at a 7-Eleven 10,000 miles away from your own bank and get information about your own financial status. But the thing that you cannot buy for any price, you currently can't get access to, and that's your own health information. And I applaud the health system in Alberta for the efforts they're making to improve it now. But until the systems are, and there's multiple systems, until they're interoperable and working and patients have access to their full health record, we have to help patients become more willing to ask the hard questions, collect the information, go back, ask again, and make their health their priority.
Yeah. If I can take a moment to weigh in personally on that, absolutely. My son was born with a congenital heart defect, and I noticed that in pediatrics, when I was advocating for him, and I wonder if, you know, I know we've got some peds people in the house here, but with the pediatric people, I found, because we were dealing with these little people, these little humans, they really involved us. I was very much part of the healthcare team. And they asked me, you know, how do you think he's doing today? What have you noticed today? Of course, I, you know, being a medical reporter, had my notebook and my, you know, pens and papers, and I was there for rounds every morning. But I really did feel like I was a part of the process. And noticing that for myself and my husband, for example, that's not the case at all. Not at all. And I wondered, wow, that's a drastic difference between pediatrics and other levels of the healthcare system. But Sarah, over to you. The one thing that I wanted to ask you is, coming up through the system and seeing it, sure, the information is one thing, but are you guys, as young people coming up, are you having these conversations among yourselves, saying we need to make these changes?
Oh, absolutely. Like,
Yeah.
students are, all the students that know this story are appalled by what happened. And when you go into medical school, you don't think about going into the system, and then you find out what the system is like, and we're all just kind of going, why?
Right.
Why is it like this? And you know, students definitely want to be part of the change, but we also feel like we're at the bottom of the totem pole at times in terms of the hierarchy of medicine and how to be effective as a medical student, and then as a resident when you're still not a staff member. How can we kind of find our voice and help push these changes through? I think that it's important for medical schools to teach medical students how to be advocates for patients, and where to access information, and how to get our voices heard in terms of making changes to the system, because it feels like we're in this black box, and we have no idea how any of it works. We just know that it works somehow, and we just kind of go through the system with everything the way that it is. Yeah.
I wonder if it's a question too, is once you get that establishment with that respect professionally, then all of a sudden you can say, okay, now we need to make some changes. But I guess the ideas have to start right at the beginning, don't they? They have to start when they're in school, and that's sort of one of the purposes of this film, is to get them as they're going up and through the system. Scott, what are your thoughts?
So I think the original question was about whether this is unique to Alberta. I've been fortunate to work in a variety of different countries around the world, provide care in a variety of different countries, and work in other health systems. I can guarantee you this is not unique to Alberta. This is common across Canada and around the world. But what I have found, and what's unique about Alberta, and it's already been brought up here, is there's an opportunity to lead a change. And I think the people are in places that want to make this change. We've got incredible students that are coming into the system that want to learn and want to make a difference in the healthcare system. We've got healthcare providers that are looking at ways they can make a difference every day. We've got leadership in the province in healthcare that's wanting to make a difference to try to drive quality as the primary driver in healthcare. So there's a lot of opportunity here. And if we embrace that opportunity and we focus on all the different things we can do to make a change, I believe Alberta can lead this. And it's the storytelling, and as we've said here, it's a way of, and Andre, you pointing out that being able to talk about this and say mistakes have been made, but we can learn from those mistakes is the only way we're going to move forward here.
Thank you, Scott. Bill, what are you hearing from the audience?
I have a tough job.
Got a big stack there.
Who do I submit my complaint to for the job I've been given? Okay. So there was an interesting question. Someone posed the question: where are the nurses in the story? And we have the author of a book. Well, we have nurse perspective, but we also have the author of a book about the nursing profession in Andre Picard. So I'd like to answer that question, but in relation to that question, I also just wanted to read a comment from somebody who's a nursing manager. A nurse manager in the audience. So thank you for this film. This comment is important because it's a thank you to the Price family. The Price family commitment to moving this work forward with honesty and fairness is amazing. And I think we all feel that here. As a nursing manager, I'd really appreciate being able to share this film with my team. Will we be able to access this film? So a two-part question. Let's talk about the role of nurses in the healthcare system, and we've touched on interdisciplinary teams, and then we could maybe have Dave answer the piece about how this film will be accessible in the future.
Perfect. So Andre, do you want to take that, or Anna Marie, do you want to take the nursing question?
I'll start very briefly.
Sure.
In my nursing book, in the introduction, there's a comment from a nurse who says, we're like the wallpaper of the hospital. We're always there, but nobody sees us. And I think that's reflected well in the film. It's the reality that we have a physician-centric, hospital-centric system, and that's, that has problems in itself. There's a scene where he calls the office and, he's away on holidays for 2 weeks. Why does everything grind to the halt when one person in the team is gone? That's not how systems should operate. So I think there's a lesson in there unspoken about we need more teamwork and more cooperation. But the nurses are there and they're doing stuff, but we just didn't see them as visibly.
Right. Anna Marie?
Yeah, well, I think in Greg's story, the nurses' participation is limited because he was treated in an outpatient setting, and there's just some other activities that on. But I'm looking at a nurse that I know well, and Lorraine is here, and there's probably many other nurses in the room, and I nursed for quite a few years. And nurses advocate continually, loudly, and daily in the system for sure for patients, and we can be pretty aggressive at times if we need to be. But the system, I don't disagree that nurses are like wallpaper and not necessarily seen in a system that's more centric around the physician role. But I also think that nurses have taken on rapid evolutionary change in terms of their roles as well in the 30 years that I've been in healthcare. And I certainly advocated for my patients quite aggressively when I was practicing, as do many other nurses today. And I think what we take out of the practice environment now, we're seeing more and more happen in the activism environment. So Imagine Citizens has nurses on with their group. I'm one of them. Health Quality Council has Patient Family Safety Advisory Committee. There's patient family committees all over the place. Many nurses sit on those committees. And because of our unique experiences, we can advocate in a more unique and maybe more explicit manner, because we know what happens when information drops inside the healthcare system in the acute care setting and doesn't get to the community setting. And we're the people at the bedside. I just had a family member, a post-op arterial bleed. The artery was nicked right after surgery, and she bled for about 9 days before her bleeding stopped. And it's very hard to be the patient or the patient's family member who happens to be a nurse at the bedside, advocating for that person's care, but also looking at a physician with the same humanity that I expect that patient to be treated with. because we're all in this together. And I think nurses see that more than anybody.
Absolutely. Dave?
Yeah, the nursing side is certainly appreciated, and there was a limited opportunity for interaction by Greg with nurses, and it actually was post-op well, pre and post-op in the hospital, and they did an amazing job for the opportunity they had, but it really was limited. To answer that, and this, we're very open to being able to have this film used in all kinds of different areas. When I talked earliest about, the ability to actually have it have impact and responding to opportunities, we'd like to be able to do that. And the plan as far as how we make this available, in the first few months here, we're going to spend time with audiences like yourselves, learning how the best way to set up screenings without us in the room. And as that opportunity comes and the supports are there through our experience and the advice that we're given, then we'll make it available to groups or organizations to be able to take it themselves, use the kit, and have an outcome that can have a panel discussion like this, maybe more targeted for the audience, and use it in that way. And then a few months more after that, probably early next year, the plan is to actually move it through into an online availability, not quite like YouTube. We're working with a company in Calgary called WorldPlay that have a way of putting this kind of film up and having a way of having that go through a few hurdles, if you like, to start with, just so we know how it's going to be used and what the purpose is, and an opportunity for feedback on what the audience then learned from it. So over the next year, it'll move from this kind of setting to a broader one that is not limited by our presence, and then ultimately available for people that are interested in positive improvement to see it themselves and to work from it in virtually any kind of setting. And obviously that would be outside of Alberta. It would be international and available that way.
Terrific. Thanks, Dave. Bill, should we go back to you? You've got a big stack there.
I do. They keep coming. Okay, so a couple of people have asked a really important question that relates to Greg's ER visit at the end, where he asked the question whether he should go and stay with his sisters who were close to the hospital, or could he go home to Acme? And so the question posed here was, Greg at greater risk by living in rural Alberta versus an urban location? So I think a couple of you at least on the panel could speak to that. So anyone jump in?
Right, so rural versus urban. Andre, you want to start?
Well, in my new book, I have a chapter on that. So
there you go.
we often talk about two-tiered healthcare, private and public, but the real two tiers in Canada is urban and rural remote healthcare. So it's night and day. Now, we can't provide every bit of care to everyone in rural settings, but we can do a lot better. Where there's real failings, there's lack of staffing, it's really hard to get healthcare providers to move to rural areas. We don't always have the right kind of facilities, et cetera. So yeah, there's real issues. I don't know if in this case it made a dramatic difference, but I think overall we can say that we have to do a lot for a country the size of Canada. We have to do a lot better for our remote regions. The other part of it I think that's important is that about this question about his sisters is I don't think anyone should ever go into the health system anymore without an advocate, a family member. Some people, I wrote a story recently about people are hiring they call them patient navigators privately. In our cancer system, we provide navigators to patients because it's complex to get cancer treatment. Imagine if Greg had a patient navigator, a nurse who is assigned to him. I'm going to take care of your case from beginning to end. The reason we have those is so appointments don't get forgotten, so CT scans don't get lost. That should be something we should invest in a lot more heavily and a lot more wisely. That's an example of something that would have made, we wouldn't have this film if he had an advocate, I don't think, or an advisor.
An advisor like that. Anna Marie, what do you think of that? I mean, you sort of dabble a little bit in this concept, or what do you think of this idea of having patient navigators?
Well, yeah, that's a tough one. you know, the only common denominator in Greg's story was Greg. You know, he was the only person that could fill the line between the dots, or put the lines between the dots, pardon me. I like the idea of navigators. I believe in them. We certainly have navigators inside the system. And I navigate and advocate for lots of people in my own personal life and in my approach to volunteerism. To build an infrastructure around patient navigation would be very difficult to do, and I'm not sure we could sustain it. What we can spend money on, build, sustain, and make sure it continues to grow is, if Greg is the only common denominator in Greg's story, Greg should have been the only person that had the most, or not the only person, but the first person with the most access to his information. I think if Greg, knowing the kind of man that he was, if he had had access to his information, Greg would have advocated admirably for himself. Not that I disagree with the idea of navigators, but like I say, you've got 4.5 million people approaching ODD in Alberta, and to have available navigators to support patients in rural or urban settings is difficult. What we can do is expand access to my own and your own patient health record, and then teach people through electronic means, through blogs and through media releases and all kinds of things about how do I navigate the system? What are the best questions to ask? What should I be looking for? What should I ask my family doctor? What should I expect from my family doctor? And those sorts of things.
Scott, you've got your microphone up.
Well, I want to touch on it just simply because what I find is that there are some areas where navigators, I think, are incredibly useful. But when you already have a complex system and you add more things to that complex system, this complex system becomes more complex. Fundamentally, and this came out in the report on the case, was that the continuity of care and the positive transition of control over important information is important. So, for instance, in aviation, when you've got two people flying an airplane and somebody says, you have control, the other person says, I have control, and there's a positive transfer of control of that aircraft. We don't do that in healthcare as well as we could. There is a difference between rural and urban healthcare, there's no doubt about it. Embracing the technological world in which we live and embrace the digital health environment that's there can help with that, can help in the sharing of the information and the positive control and transition of that information from one care provider to another, with that common denominator of being the patient who has to carry that through and have access to the information. We do need to embrace that that sharing of knowledge that's out there, the sharing of information, and we can use that using the technologies that actually do exist today.
Terrific. Dave?
Yeah, I think one of the things that needs to be said is that people make choices on where they live, and they do that knowingly. So one size fits all is an unrealistic expectation. But if you put in place a system that allows local priorities to be established, and that kind of priority then to be able to meet that population's needs as they choose, now you've addressed that in its most appropriate way, rather than having somebody somewhere else make a decision, well, you really don't need that because I know you don't. I'll give you this over here. And so you need, I think, a big part of this is getting it back to having it being more locally driven, locally responsive, and end up with more satisfaction by the population understanding what that means. And if I can't get this particular treatment within 20 minutes, I know I can go another 20 and I can get it someplace else, rather than this idea that it all needs to be the same. Now, the other part, I think, you know, the navigator idea for me is a Band-Aid. If you've got a system that actually is functioning well together and the people are well informed, as Anne-Marie says, and the people at the center, and you know, it's a complex system. There's lots of other complex systems, and they've got systems about tracking and making sure things are there and outcomes are met. So I don't buy that either. I mean, it just means that you have to be more disciplined and may have a better understanding in your team on what it takes to make it happen. If we can put men on the moon, we can figure this out. The food industry does it all the time, right? So I'm not being critical as much as wanting to set the bar a little higher than using a Band-Aid, right? what we need to do, and this is where the public has a huge role, we have historically been way too accepting and way too assuming about how things need to go or should go. What we need to do is be a lot better informed, and like Scott says, raise the bar, have the understanding, and if we actually set that high enough, then things will adjust and come to it. If we just sit back and say it's fine, okay, it's fine, then we stay where we are.
Thank you, Dave. Sarah, if I can ask you, there's been a lot of talk about the technology sort of being the fix, fix the technology and that can help us, whether it be for the rural-urban connection, the telehealth or whatever the case may be. Are the younger medical students seeing that technology, it could be the big solution and that it's not being used nearly as much as it could be?
Well, I think, technology is definitely not being used as much as it could be, but Alberta is doing relatively well, I would think, compared to some of the other electronic medical records across the country, which has already been alluded to. I was in a major hospital in Vancouver and was shocked to see that when you put in an order to give some medication, you write it down in your scribbly handwriting and it gets faxed from one floor of the hospital to another. That's archaic, right? Whereas in Alberta, at least, we're able to put that in a computer. And I think that we understand that it's difficult to get everything on the same page and to make massive changes and to retrain, all of Alberta Health Services into a brand new system. That takes a ton of money and a ton of effort. But we do, I think it's definitely a good solution, yeah.
Perfect. Bill, back to you. What are you hearing?
Okay, we brought Andre Picard from afar, and so this is a really important questions, comments that are on health policy. So I'll read them both, and I'll use a strategy of partially answering as I hand it over to Andre. So the first question is, would a shared public and private healthcare system help speed up reform? So the partial answer to that is we already have a shared public and private system, but maybe Andre can elaborate on that answer. And then the second question that's related, is it time for an honest discussion about providing more options for Albertans to get quality health care? Perhaps more private options would lessen the burden on our public system and make care better. And I was just going to comment there and say the most privatized system, the United States, in a Commonwealth Fund international ranking was ranked number 11 out of 11 systems. The best system was the NHS in the UK on so many indicators. So those are partial answers. Andre, really, I think the health policy expert in this country, comment on public versus private, public and private.
Yeah, so we could have a long discussion about this, but to me the short answer is it's a false debate. The reality is we do have a lot of private health care. The question is, where do we want what's the proper mix? So I think we can probably all agree, regardless of our political leanings, that we don't have the right mix of private and public care in Canada. So we have this, what the academics call a bifurcated system. So 100% physician and hospital funding publicly, and then everything else is all over the map. About 45% of drugs, 6% of dental care, 30 to 40% of home care is private, or public, sorry. So it's a real mishmash. And what other countries do that have better systems than us, and I don't talk about the US, it's an outlier, it's not a system. But if you look at European systems, they fund about 80% of everything publicly, and then they top it up with private care and private insurance. And the other thing that they do is they administer their public systems well, they have accountability, and they regulate their private systems well. And I think in Canada we have the worst of both worlds. We have kind of a wild west of private care, and we have pretty poorly administered public care. So that's the issue to me. It's not whether we have private or public, it's how we use it, how the expectations we have it. Our public system can learn a lot from private enterprise. Again, we see that from the film. Private enterprise would not lose a patient because they would lose money. So we have to build in that accountability and that expectation, but it doesn't necessarily have to have a private profit motive. So that's my short answer. We could talk about that for 2 hours, but.
Thank you, Andre. Bill, should we go back to you?
Scott, anything to add to that? It's a tough one, but you've
Sure.
talked about you've worked in different systems and.
So I have worked in different systems and I don't think there is an easy answer as to whether more private would make a difference, but I think what we have to ask ourselves is, in the private systems that do work, what is it that makes them work? And fundamentally, it comes down to an accountability around quality. And we've got lots of accountability in public systems, not just the healthcare system, in any public system, about how money is spent. But we don't necessarily have the same accountability around the quality of the outcome product in healthcare. So if we had a focus and an accountability framework about the quality of the care that somebody gets, I think that would drive more change than just making a private system that would use quality as the driver, because quality healthcare is more cost effective. You actually do cost less. It's less expensive to run a system that has higher quality outcomes. And there's lots of evidence to prove that already.
If I could just add, I think in Canada we obsess far too much about the cost of healthcare and not enough about the value of the money we spend on healthcare. If we changed our attitude, we wouldn't have to worry about the cost.
Yeah, I agree.
Does anyone want to talk about pay for performance, not pay for play? Anybody following the news, but pay for performance.
So if we may mean pay for performance as the accountability around quality, then I think that should be a real discussion. Are we tracking who's providing the best care, where is the best care being received, and do we have a payment system that encourages quality care as opposed to fragmented care that really our system is designed to provide, is a very fragmented approach to healthcare. So payment for performance based on payment that's focused on quality outcomes, I think that's valuable.
I think, just if I could add to that, and I'll pick up on a word that you used earlier, and that's partner. Often we are told when we're mixing with people thinking about the care that they're being provided, is that they might make choices that are different and don't require the same high level of care in order to have a healthy or more comfortable lifestyle at that stage. So the major needs to be back with the patient and their family saying, well, here's the information, here's what it looks like, now what do you choose? As opposed to a system that tends to reinforce transactions rather than actually listening to the patient.
Yeah, I agree.
I agree also. The one thing that Anna Marie, you and I were talking about too, we've talked so much about the system and the technology, but there's a human element to this, I think, as well. When it comes even to doctors talking to patients, nurses talking to patients, that human element, I think we sometimes are lacking in the system. Certainly I've witnessed that with my son. And it's a question of if you care about your patient deeply and see them as a human with family, and I just wonder if that isn't going to influence the care, and you make sure that those little things aren't dropped. What are your thoughts on that, Emily?
Well, I think there's fantastic people inside the system who want exactly that. And it's like Scott just mentioned that the system's performing exactly the way it was designed to perform. And when we think about the influx of information and how I believe we truly are living inside a system now, the humanity, our willingness and our ability to even recognize the humanity of an individual patient can sometimes be lost in favor of a diagnosis or a procedure or all of those things that happen. A patient, it becomes compartmentalized between specialties and systems and everything else. And what we're learning even through our interviews in the last 4 months with health professionals is that, first of all, everyone wants to be more human in their approach. And second of all, I think we're recognizing that when we go back to that 100 years ago when the physician had a lifelong relationship with a patient and knew that person as a whole person, that's when exemplary health care based on what was available in those days could occur. And I think the pendulum is starting to swing back, or we're recognizing the pendulum needs to swing back to the idea of relationship and humanity. And Greg's story is a tragic example of compartmentalizing his situation through steps in the process that he was unable to navigate. Good people are doing the best they can in a system that is highly flawed. And I think that that's the way to get back the way to give joy at work, like the Institute for Healthcare Improvement talks about joy at work for health professionals, the way to guarantee joy at work is to give health professionals the permission to really develop relationships with patients. And instead of worrying about burnout and stress, start celebrating with each other the fact that they were actually able to pick up the baton and save someone's failures. You know, help a peer out to get someone else through the system, to talk about the good things that occur on a day-to-day basis and tell stories. And Dave and I were talking about storytelling and sharing stories with health professionals so that we can rebuild the culture of healthcare in this country to one of more relationship and compassion and humanity.
Could I just add to that? I think the common trait of the best health systems in the world, they have one common trait, and it's really good primary care. They have someone who's responsible for the patient. You know, if you go to a country like the Netherlands, everybody has a primary care provider from birth until death, and they help them through the system, and they organize them, and they're responsible for them. And we don't do so well on primary care. We're very disjointed. We treat conditions rather than people. And you know, healthcare ultimately should be a hands-on business. It should be a people business. And again, we should talk about value and what people want, as opposed to, you know, how much does it cost and who's going to do it. So it's about culture, and it's about priorities.
People and relationships. Perfect. Thank you. Scott, did you want to weigh in on that one? If we had a word, Will or Bill?
I can just provide a small example. Recently, I was speaking to an emergency physician practicing in Alberta here who has a colleague who started to embrace the concept of compassion in their day-to-day practice. So this is an emergency room physician who's embracing compassion. Imagine that. And is teaching students as they come through about how you embrace compassion as a part of what you do. And what they discovered as they started doing this is their own personal joy in the work that they were doing every day, and how their level of burnout actually went down. There's this belief that you get a lot of compassion fatigue, but you also, as you use compassion in your day-to-day work, you build an importance and a value to what you're doing as well. And feeling like you're valued and feeling like you're making a difference can also be a very positive thing.
Absolutely. Thank you. Bill?
Okay, and we're at T-minus 7 minutes, so I'm going to try.
Okay.
I want to try to squeeze in 2 separate questions. So the first one is really directed to Dave, but also to those of you who've seen the movie more than once. A number of you have asked what the reactions have been of healthcare providers or audiences who have seen the film. Obviously, I know Dave, with Terry, and probably with Ward, you've been at just about every one of the showings, so you have that firsthand view of how people have reacted. Can you give us a capsule summary of what the journey of showing this so many times already has been?
I think Terry alluded to it a little bit, and that is that people have commented about the sort of neutrality of it and the quality of it. And we've not shown it to anybody that has said that it's a tough, bad thing to do. Everybody's been supportive of what we are laying out there as being an opportunity for improvement, and I think everyone would say that they've seen things in it that have made them stop and think about how they've been going about their tasks in the past. So that goes right from the minister all the way down through the system. And you know, I'm sure that we didn't have all the audiences there, but the ones that we've had have been fine with the idea, appreciate the quality, understand the goals, and for the most part are willing to be part of supporting those goals.
And Sarah, I know you've seen the film with your medical school class. Scott, you've seen it before. Any just testimonials on reactions to the film by stakeholders?
Yeah, I mean, tears would be one of the things that definitely flowed when students saw the film. Again, just being inspired and being having our eyes opened to what we're going into, and just overwhelming gratitude for the Price family for sharing this with us. And I think, you know, I hope that this becomes mandatory viewing for every medical student and every healthcare worker across the world, because I think that we lose the humanity in medicine when you see patient after patient after patient, and we need these reminders. And sometimes we get them from patients. You know, today I was on prenatal follow-ups, 5-minute appointments, patient after patient after patient, doing the same thing over and over. How are you doing? Update the records, listen to the heartbeat, go on your way. And I think it was like my 12th or 13th patient found the baby's heartbeat, and she started to cry. And it made me pause, because of course this is such an emotional thing for her and for her husband, and to listen to their baby's heartbeat. And we need to pause and think of the human, because it's difficult to do that at times when it seems like we're just seeing one person after another all the time.
Of course. Bill, let's go back to you. We want to get through as many as we can.
Okay. So a number of people have wanted to understand, because they're hearing that there are changes in the works. Some things have happened. So really a capsule summary of many of your questions. How have things changed in the last 6 years, and any specifics that can be shared? And that's a tough one to close with. You know, there's some comments here about initiatives like Connect Care, the personal health record. So people are bringing forward some of the changes, process changes. Primary care was mentioned. Somebody's commented on the primary care attachment or alignment registry, which is an explicit attempt to do what Andre was referring to. So those are some of the changes. Any comments? What has changed in 6 years? Because we're leaving the theater after this volley of responses, so this is an important answer, not to put pressure on you all.
Dave, did you want to take that one, or?
Well, I can take a shot at it, sure. I mean, I've got, I think that it's a challenging question, because in our world, which is the food industry, agriculture and food, we get to decide and do things. And in the health system, there's not one or two or three decision makers, there's a whole bunch of different ones. And even inside the biggest employer, the Alberta Health Services portion, it's not as easy as just making a decision and having things change. So you kind of need to work your way through it. I think there have been changes. Scott referred to the after hours standards and the referral standards that have been changed by the college, and those are very good things. It still takes a little more than that, though, because it requires the public to understand what those standards are and then talk to their doctor if that standard's not met. If a referred to doctor doesn't respond as the standard expects, then there should be two people alarmed about that, the primary care doc and the patient, and they should cause things to happen. So, you know, making changes that don't have an appreciation associated with them, it's a little bit like posting a speed limit and a sign that says, well, we're not going to check, so you're okay, right? And so that kind of thing needs to happen. I think there is an elevated level of engagement. There's an elevated level of willingness to talk and a desire to move forward. What the public still needs to do is to pick up the torch a bit and support the great people that are trying to do the right thing and make improvements, and make it a little easier for them to swim upstream at times, knowing that there is the support to make it happen. Because when you do that, you actually clear the way by establishing a public priority that drives a politically managed system. And when you recognize that set of dynamics, you're most of the way there to making change. You're not going to do it any other way.
That might be a wonderful place to wrap. Bill, should we?
Yeah, maybe it is. We are giving. Dave is going to be making some
His closing
closing
remarks,
comments,
yes.
but maybe Andre, you know, you're an observer of healthcare, a commenter
Have
on
you seen
healthcare.
some change? Yeah.
Yeah, and then talk about the Naylor report and the Romano report from 2000, the Mazinkowski report. I mean,
Yeah,
a lot
I'll
of
spare you
reports.
the report stuff, but how about, I think there's been two big changes. You know, I think there's constant change. The problem in Canada is I don't think we change quickly enough, so we got to speed that up, scale up our successes. We don't do a good job of that. We've solved every single problem in that film, every problem in healthcare, we've solved it 10 times in a pilot project. We've got to learn to scale stuff up. Now, on more specifics, I think in the last 6 years there have been two really important major changes, especially out west. I think one is in medical education. I think there's a lot more teaching of, we're not just going to teach you stuff, we're going to teach you how to communicate, we're going to teach you the importance of listening. I think medical education has changed pretty fundamentally in that way, and I think that's really good, and it'll be good for patients and for providers. And the second one is, and this is very unique to, I think, Alberta, Saskatchewan, there's a real discussion about quality and how quality should be where we begin and where we end, and stop talking so much about cost and more about the quality of care, the value of care. And that's, I think, where Alberta and again Saskatchewan are really showing leadership that other provinces really need to pick up. So I think those are two biggies, and they come in large part out of Greg's story. That quality discussion, I think it was triggered by that report was really, really important on that issue.
And that, of course, is thanks to the Price family. Dave, let's end on you this evening. You've got some closing remarks for us.
I do. I think most of them have been said already. No, actually, I should grab my notes because I know I'll forget something. But I think just to follow up on Andre's comments there, the early part of our journey, we knew as a family that had lost a loved one, that we would just be a family that had lost a loved one unless there was some ratification of the kinds of things that we saw. And it's, you know, Patricia Pelton is here tonight, and a number of people from the HQCA, and certainly Ward led the investigation, and we knew that that would be a foundational report. A group of experts viewing what Greg went through, writing a report, putting out a series of recommendations. Okay, now we can build on that foundation as members of the public and as a family that experienced that and start advocating for change. And that's, for us, that was the foundational difference in our belief and able to be moving those recommendations forward. Now, were they all adopted, and are they going to all be put in place? Well, it's been 6 years and time will tell. That tells you sort of enough right there, right? And so the challenge really is we've learned from experience that we moved from believing that we could shine the light on the great people inside the system that are wanting to move things forward and provide them support and have things change. And we learned in year 2 or 3 that that really wasn't going to do it because it was not enough leverage. What we need is, and this is why this film has so much value, we think, or potential, is that if the public becomes aware and don't make the same assumptions that we did as a family 5+ years ago, and actually become engaged, ensure that we're knowledgeable, and then be in a position to make choices and make decisions. If the public does that, now we're all working together, and the people inside the system and the people outside the system can join together and make things happen. It won't happen any other way. It needs to happen that way. And when Andre talks about the pace of change, well, that comes with comfort. And people don't like change because it's uncomfortable. That's not unique to the health system. What we need to have is the priority set there so that it's not comfortable to not change. And then it starts to move in the right direction with the right kind of pace. And I really appreciate Scott's comments because his early remarks set a vision that said, that's kind of different than what it used to be. That's saying, you know, we really have to look at this in the big picture and set our goals and move that quality needle. And for me, it's more than quality. It comes all the way back to safety. And anybody that's employed by anybody knows that you don't have a safe workforce or place of work unless that's your #1 priority, right? If it's just lip service, it doesn't happen. So if we're actually going to focus on what we need to do and what we need to deliver in order to have a safe and caring delivery of the right kind of partnerships and team in the healthcare system, patients, their families, and the public at large have to be engaged, have to be advocating, have to be establishing the bar, and then ensuring that it's reached for. And if that means changes in how we manage the money, and that means changes in terms of how it's structured, so be it, because that's the target, not the other things that get in the way. Just like in a safety program, if you're, I'm not really going to put that piece of equipment over there because that's inconvenient. Well, no, if we're actually believing that that's a safe place for it to be, we make it happen. So if I can just end a little bit now on, first I'd like to thank the O'Brien Institute for co-sponsoring with us this event. They've been a great help. Obviously the professionalism has meant it's easier for us to put this on and have it happen as it should. I'd like to move on to thank obviously both groups of panelists. I won't thank myself, but everybody else. And that the rich discussion, the comments, and the response to the questions is really a big chunk of our goal. And so hopefully when it comes time to leave and reflect on this, you take something home. I know I have, I will. And then sort of move on through the list to say, we wouldn't be here tonight looking at a film if it wasn't for the cast and the crew and the wonderful work that people like Andrew and Dean and Kevin and Becky and all of the people, Karen, that actually made this happen, because that's the next platform off which we can work. And then I'd be remiss if I didn't thank my family and all the people that behind the scenes that actually did a bunch of the work in putting this together, and in particular putting some of the other pieces in place, like the Greg's Wings pilot collective, co-pilot collective, so that we're in a position to be able to interact with you without you actually having to sit there and stare at me. You can do it virtually and have the discussion and make things happen that way too. So what I'd ask is just 3 things when you go home now. Oh, I should mention, I'll mention 2 things before I forget. One being, as Bill mentioned, questions that didn't get answered specifically, if we've got them on cards, we will put them into the co-pilots collective work, and they will be answered there. So if you go through the Greg's Wings, sign up to be a co-pilot, you'll see the questions and you'll see the answers. So that sort of fills in the blanks that you might feel aren't there in the questions that were asked. Now, the other things that I'd like to ask you to do is, first is recognize, and Anne-Marie did the best job of us all in terms of hoping to energize you to be the best partner and advocate in your own, your family, or your friends' care. And that partnership, I really mean, is a decision-making. Too many of us have sat back and gone along for the ride, and you don't know the destination if you're doing that, right? So you need to be doing that. The second is, part of this movement is to have safe conversations between each other at the coffee shop, your friends, your family, but also do that with your providers. Or if you're a provider, have that with your patients. And understand each other's challenges and be in a position where you're well enough informed so that when questions of policy, and if Andre writes a column that says this is a story and you don't think that's quite right, you're in a position to know whether that's a fit or not, as opposed to just accepting it. So take it to that next level. And then if you've got those 2 things covered, you'll be in a position a year or more from now to help support the people that are making good work transition into good practice. And then the last thing I would ask you to do, and I've kind of done that indirectly, and that is take some time, think about it, and really consider joining the platform that's being developed, the Co-Pilots Collective off gregswings.ca, and consider just entering enough to know what's going on, and if you feel like contributing, do that, because that's the place that we want to have conversations beyond what we can do with 370 people in a room. So thanks very much for coming. Some of us will hang around here if you want to have smaller group conversations. I know there's some great people that have come here. If you catch some of them, you'll get good conversations going amongst yourselves, and indeed the rest of us will be here too. So Thanks very much.